name is Tom Kelly, and I am a theologian at Creighton University. And one of my sort of outside side jobs is that I take people on immersions to different parts of Latin America. Since then, we've added a nurse named Redline, and Huascar, Dr. Rodriguez, volunteered after the first time he visited the Batey. He said, I want to help however I can. And so he and Redline have been kind of the team who have been monitoring and measuring the children over the 6 years that we've been working together. So I like to think of ourselves as sort of a tri-national team. Myself and the people back in the States who support this through their resources, Huascar and ILAC and Jose Miguel, and the Dominicans who support it here, and then of course Redline and Maria and the community in Batey Dos who support it from there, and we all work together. Just seeing the children healthy keeps me coming back. So grateful that people see a need and want to respond to it, and have done so faithfully for 6 years now. But I would really like to see them free and independent and self-sufficient. I think that's our goal.
I am a current volunteer here for a year with ILAC, and I've been working with Dr. Rodriguez as I'm a pre-medical student applying to med school right now, and I actually got the opportunity to visit Batey Dos with Huascar and work with Pascal's Pantry to help collect data for his project, as well as hand out medications and pick up on his patients that he's been working with there for several years now. My role with this project is I'm really serving as support for Huascar and the rest of the team, helping with the manuscript side as well as in the Batey, and really getting to see the transformation of the kids from when the project first started to now, and how important the social determinants of health are throughout this whole process. Things such as nutritional needs and sanitation and a lot of these basic rights many individuals don't have access to. And being able to provide these things and provide a more holistic and well-rounded care has made a huge difference in the life and well-being of these individuals in the Batey. There have definitely been challenging moments throughout this process, especially recently as Haitian-Dominican relations have been tense and restrictions here in the Dominican Republic have tightened. And recently, many individuals have been sent back to Haiti from Batey Dos, and watching this has been very difficult. But also the fight for their rights and continuing to work for these individuals gives me hope for the future. And from my experience in the Batey and just really getting down to see humanity and the rights that aren't always afforded to these people but can be given, also provides hope for the future and what we can all do together as a team working for and with these individuals.
In a setting with so many social determinants of health, this poor community faces a lack of healthcare system, lack of food, lack of safe drinking water, education, electricity. As a physician, I have identified in this population malnutrition, upper and lower tract infections, anemia, diarrhea due to parasitic infections, allergies, skin infections, among others chronic diseases. A couple of years ago, I had the opportunity to meet a child while I was doing an immersion alongside Dr. Tom Kelly from Creighton University in a poor Haitian community. The child was struggling with severe malnutrition. He was always sitting in the middle of the community with flies surrounding his face and hungry. He couldn't crawl or walk, but anyone could tell he was malnourished. The little boy lost his father shortly after he was born, and his mom working the garbage dump collecting recyclable to sell. Ultimately, that day, he impacted my heart that the most MVP I should be chasing is the most vulnerable people around the world. We have made great advancement, but there are still so much needs in this community. So we hope this initiative will be able to continue into the future and continue to impact the life of a very vulnerable population, and that no more children have to suffer in the way of how Pascal did many years ago. Mahatma Gandhi said, "The best way to find yourself is to lose yourself in the service of others."